Welcome to the Teeth Chatters podcast, where we chat all about the correlation between oral health and systemic health. My name is Sarah Giuliano. I have been a registered dental hygienist for over a decade. Now I'm about to branch out from the dental chair into the community to all you beautiful, amazing people. Together, we can connect the body to the mouth through educational podcasts. So let's get this show started. Welcome, my lovely listeners, and thank you for joining me today again on this another amazing podcast. I have a phenomenal guest here today. Her name is Jill Meyer-Lippert. Jill has worked in dentistry for over 30 years, with 25 years as clinical dental hygienist. She is also the founder of Side Effects Support, which is an online resource for cancer patients, family caregivers, and healthcare providers to reduce harmful oral side effects of treatments, improving quality of life as well as treatment outcomes. Jill is a 2014 recipient of the Sunstar America's Registered Dental Hygienist Award of Distinction. She holds a certificate in oncology management and provides educational and community relations services with Custom Dental Solutions as their community relations manager. Jill is a member of the Registered Dental Hygienist Advisory Board for the Oral Cancer Foundation, Teeth Cloud Thought Leaders, and was named as one of the 6 dental hygienists you want to know by Dimensions of Dental Hygiene magazine. Wow. Jill, welcome to the show today.
Oh, thank you. I appreciate the opportunity.
Great. Okay, so let's get started. So I have some questions to ask you. This is what I always like to ask my guests just to kind of start things out and kind of keep it light. So as a segue into the podcast, who is Jill Meyer-Lippert? And tell us a little bit about yourself, who you are outside of dentistry.
Okay. Well, I live in Wisconsin,
Okay.
A little close to Lake Michigan. It's very beautiful here.
Oh, I bet.
But I grew up in a very small town that's only about 15 minutes away from where I live now. I'm married to my high school sweetheart. All of our families in that area. A super like little house on the prairie, boring.
No, I think it's lovely. So let me ask you, what inspired you to get into dentistry and become a dental hygienist in working in this field?
Surprisingly, I've always loved dentistry, even when I was little.
Yeah.
When they have all these pictures of me brushing my teeth as
Wow.
like 3 or 4 years old, sitting in my Winnie the Pooh sleeping bag, brushing my teeth. And even in my my school papers that my mom saved for me, it's in kindergarten, it says, what do you want to be when you grow up? And I had a dentist. So it always seemed like it was kind of destined to be. But then, of course, going into grade school, high school, then I kind of started looking into other things, but eventually just found my way back to dentistry again.
That's fantastic. And you've been a hygienist for how many years?
I got my license in 1994.
Okay.
But then I started actually as a dental assistant in 92. So this year it was 30 years since I started my first job in dentistry.
So let me kind of veer off a little bit here. So how much has dentistry changed for you over the last almost 30 years? Think about that.
A lot.
A lot, right?
The technology, the knowledge involved, it's really amazing how things have expanded.
Yeah, which is fantastic because with that comes more definitive diagnosis with things, better treatment plans, things like that. I mean, it's amazing how far dentistry has come. And I feel like every day, being in this field, every day I'm learning more and more about new products and new techniques and new way to do things. I mean, it's like in anything in the medical field, it's ever evolving. And I feel like we're learning every day.
Absolutely. And I know we had talked a little bit before this about how fun it is to have that light bulb going on for people about that oral systemic link and how important that is. And it's just something that was not well understood when I first got into dentistry. So now it's really such a great thing to see.
It is. I had done a podcast about 3 weeks ago with doctor. His name is Dr. Charles Reinertsen, and he actually just recently retired from dentistry, and we did a podcast, but his focus for the last almost 44 years in dentistry has been on oral and systemic health correlations, which I think is phenomenal, because the fact that he is, retired recently this past year, but he always just said, he goes, I always knew that there was a connection. And even now he goes all over the country and he does public speaking and he has done TED Talks. And, it's what I told him. I said, we need more dentists like you.
Yes.
We do.
And it's just the thought process for all those years that the mouth was not connected to the rest of the body it's so ridiculous to think of it now, but it just the way it was.
Yeah. And my favorite thing, and I'm sure you've heard this over and over being in the dental field, your patient comes in, you sit down, first thing you ask, any medical changes or, medication changes, right? And the first thing, patients will say to me, well, why do you care? You're just cleaning my teeth. Why do you need to know? And I'm like, Are you kidding me?
Yes, that I remember so many saying, well, I do have medical changes, but nothing to do with my mouth.
Oh, I love
that. And then they would start telling you about the joint replacement or the heart problem.
And you're like, back up.
Right. I know.
Yeah, exactly. It's crazy, isn't it? So I see, obviously. So tell me let's talk a little bit about side effect support. So first of all, how long have you been focused solely on the side effects of cancer?
Well, I'll take you actually back to 1992 when I started my first job in dentistry.
Okay.
I became interested in this right away, even before I started dental hygiene school, because my mom received a breast cancer diagnosis. Okay. And when I saw how badly she suffered with problems from her chemotherapy, the very, very dry mouth, terrible oral mucositis, and the fact that she asked her oncology team, what can I do? I'm in so much pain. They basically just shrugged their shoulders and said, it's just part of treatments. There's nothing you can do. And, at that time, it really bothered me. But I didn't know any better myself. I just really kind of foolishly thought, well, now I work in dentistry. It's the mouth. I should be able to find these answers for her. So I would ask other people that I worked with, ask the dentist that I worked for, and I found out there really wasn't a lot of help on the dental end for people either. And then I thought, well, I'll learn about it in school, I'm sure. And then I learned only a small amount that I really just knew that there was something more that we could do. Mm-hmm. And there was just a lack of this communication between the medical and dental teams. Patients were falling through the cracks as far as this went. So it just started out as a quest right off the bat, mm-hmm. that I knew there's something that I needed to do with this. I just really wasn't sure. So it really started blossoming through the years with all different patient experiences then, whether it be somebody that went through head and neck cancers, people that had gone through a bone marrow transplant and had graft versus host disease. It was just such a wide array of problems for all different types of cancers, all different types of treatments. And so many times that I saw that frustration in that patient's face. They just felt so defeated with all of these problems that they were having and nobody really knowing how to help them. So eventually my dad ended up getting cancer as well. And he unfortunately did not survive his cancer.
Oh, I'm sorry.
And, thank you. But that was really my wake up call. I'm like, I know there's a need here and I want to do something about it. I want to take action and not feel like a victim in all of this. I want to empower people to have more control over their health and their comfort and their quality of life. So it really inspired me. First, I started a volunteer program where everybody at the cancer clinic where my dad had received treatments basically got a little goodie bag, and they went home with product samples, information, and things they could just take home and start using right away. But just with the financial climate, I could not keep it going indefinitely, unfortunately. So I wanted to find a way to really expand the reach and help more people. And I knew it wasn't just a local issue. I knew this was, a worldwide problem. So I looked for an online resource. I couldn't find one. So I just...
You made your own.
Yep, thought I'd make one.
You know what I love? Listening to you and talking about what you're saying, but also seeing your face and how you light up when you speak about this. It tells me and shows me how passionate you are about this. I could see it. And I have to commend you just for that, because you ignited, well, you're between your mom having cancer as well as your father, and you watching their struggles, as well as seeing other patients that were undergoing chemo and radiation as well. But it ignited a fire within you to say, okay, I need to do something about it. But you pursued that and you followed that through. And that was so many years ago. And now look at how far you've come. My gosh, this is phenomenal.
It is. I actually launched the website in 2013 and had absolutely no idea what I was doing. None. I didn't know how to do marketing. I knew very little about social media. I'm not technically savvy as far as the technology end of things. It was just truly that passion, that drive that I just kept learning and figuring it out along the way. There were a lot of tears along the way too.
Sure. The pain that comes with the endurance. I get it. Yes.
But, again, as time goes on, there's more understanding about the oral systemic link. There's more understanding about the need for patients. And that satisfaction when I have a patient reach out to me or a family member that says, hey, I actually slept through the whole night last night because I didn't have to wake up and drink water, because my mouth being so dry. Or, boy, my doctor is so surprised that I'm not having mouth sores during this treatment. He can't figure it out. All these different things that, boy, when I hear that, everything is worth it. I absolutely love it.
Absolutely. And I think that this is phenomenal. And I feel as if we need more dental hygienists like yourself that have a passion, even if it's focused to a specific area, like yours, I know is focused more, towards cancer and cancer treatments. We can really change the game.
Oh, absolutely. And that's so nice for, especially these young hygienists that are first getting into the industry. There's so many areas like sleep dentistry and even the ergonomic factors where people are understanding more the importance of things like that. There's just a lot of really neat ways to go into this profession now.
I agree. And I feel the exact same way. I've been a hygienist for about 13 years, and which I know doesn't even compare to experience that you have. I'm still newbie, guys. But I always was very passionate about listening to my patients, especially my patients that would come in that were undergoing chemo radiation. They would say, my teeth hurt so bad, I can barely chew, or I can't swallow, or I have this altered taste in my mouth I can't get rid of, and nothing tastes good and nothing smells good. And I, being like yourself, I would feel their pain. But but I also back then didn't know what to do. I didn't know how to help them. But you spreading the word in your platform growing is actually impacting not only their oral health, but think about it. It's making their nutritional, I'm going to say their overall nutrition probably better as well too, because if you can swallow your food and you can chew and you're not super sensitive, like hopefully you can ingest the nutrients that you need while going through these treatment therapies to maintain a stronger immune system. And I think that that is vitally critical when somebody is undergoing chemo radiation, because it does alter their immune system as well.
Oh, absolutely. And, the physical aspect, the psychological aspect of it. I'm sure that you've experienced that as well. Sometimes we would have patients come in that would be so ashamed of how their mouth looked that they would actually stop themselves from smiling. I can think of a few patients right off the top of my head. Every time that we would talk and they would start smiling, their hand would go up over their mouth and they would put their head down, and they just actually had their joy taken away because of their oral health problems. And then I think of the financial aspect. That is one thing I focus on a lot, is that cancer can be just financially devastating to a family.
Absolutely.
And, if we can think of the preventive aspect of not having them leaving the cancer treatment sequence with thousands of dollars worth of dental work that needs to be done,
right.
That in itself is so valuable for them.
Absolutely. So do you go to oncology centers? I mean, do they allow you to do any form of education?
When everything started shutting down, I have to say, I had actually more opportunities open up because so many of the patient support groups went virtual where they weren't before. And now I can, I'll get opportunities sometimes to do virtual presentations out east or all different states, even with some of the cancer nonprofits. They will do educational programs that they've been doing more in a virtual setting, and those opportunities are growing. And honestly, that is my favorite part, is when I can speak directly to patient support groups or have that one-on-one contact with patients and help to answer their questions.
Absolutely, because you know that you're talking directly to them and you're reaching them directly. Have you found that any oncology centers have included oral health as part of a form of their treatment plan?
There are some. There unfortunately are not a lot.
I know.
There's one cancer center out in Little Rock, Arkansas called Cardai Cancer Center. And I have a great relationship with the hygienist that is in their dental program. So they actually already have a dental office where right now it's focused more on the head and neck patients. So before they go into their treatment, they have the dental work done, they have a full examination, and then they're provided the information. And actually, I work with them to help provide a kit of products. So people go into their treatments with full-size products that they can start using right away to help address the anticipated problems before they even have a chance to start. And that's a great program.
Well, and I think that that's phenomenal, because one of my big lines I always use with my patients is, let's be proactive, not reactive. Yes. And that's exactly what you're doing.
Yes, exactly. And that is one of my battle cries, is that, if we take a person's medical history, we take their dental history, we know what the treatment plan is, we can reasonably anticipate what type of problems they're at risk for.
I agree.
And let's address them before they even have a chance to start, because once they start, putting those fires out is difficult. So if we can at least delay the onset of the problem, or minimize them, or possibly prevent them just through being proactive.
Do you find that you get a lot of patient compliance in regards to that?
Just like anything, that can be a hit or miss.
She's like, come on, sir, this is dentistry. People either listen or they don't.
Exactly. But I have to say, that when you receive that diagnosis, that is, for most people, quite a wake-up call. And if they know, boy, just by making these small, simple changes, I might make this a better experience for myself, I might get better treatment outcomes. That is a huge motivator.
It's almost like a scare. They're almost scared into that, which I hate saying it, because at that point, once they've been diagnosed with cancer, know that they're going to be undergoing cancer treatment therapies, it is a wake-up call.
Absolutely. And it's not for everybody. I use the example that I remember having a patient years ago that he smoked all the way through his treatment. And I remember asking, what does your oncologist think about this? And at the time he said, my oncologist said, you've got bigger fish to fry.
Wow.
So if that gives you comfort, and he goes, the last thing I need you to be doing is going through withdrawal at the time too. He said, so if we can get you from point A to point B, after that, we'll try to work on that. So there's sometimes different philosophies. I can't say that's probably a real common recommendation, I'm thinking.
That's a good thing. It's not a common recommendation.
Right.
Jeez.
So yeah, sometimes it's just, but again, sometimes being that cancer is such a difficult, complex subject, people a lot of times assume that everything they need to do to help themselves must be these really complex things. And sometimes it's not. Sometimes it's just really simple things that they don't have to add to their routine. They can just tweak their routine a little bit.
Can you share with our listeners the impact radiation and chemotherapy has on cancer patients' overall oral health? So I know that we're talking about it kind of as like an umbrella topic, but tell me more specifically what you notice clinically that is really detrimental to their oral health, that the changes make from cancer therapies.
So many cancer therapies have dry mouth as a problem, and the dry mouth can be, of varying severities. But the drier, as you know, somebody's mouth is, that just makes them more susceptible to tooth decay, to periodontal disease, to all sorts of infections. And the drier their mouth is, the more susceptible they are to develop what's called oral mucositis, which is the inflammation and ulceration of the oral mucosa. It's just the tissue is more susceptible to injury. It doesn't have that lubrication. And of course, the infection aspect of it, thrush, or oral candidiasis, is a huge concern, which can be very serious for somebody whose immune system is so compromised. So the drier somebody's mouth is, the more likely they're going to have problems with infections.
And with oral mucositis as well, I mean, you think about it, I've heard of cases where people can't even swallow. It hurts to swallow. And then unfortunately, they'll have to, be hospitalized because they're so dehydrated.
Yes, oral mucositis is actually one of the main reasons that people have to alter or delay their treatments some way, whether it be due to pain or infection. And every time that somebody has to alter that treatment, they've lessened their ability to get the desired results. So when somebody receives a treatment plan, we want to do everything we can to keep them on that plan moving forward.
Sure. So do you have the opportunity when you do, speak, and as well as, maybe educate other younger hygienists that are maybe up and coming so that they can also be aware of things like this? Do you have an opportunity to do follow-ups at all with the patients to evaluate and see how they're doing?
At times, usually, and that's always on the patient's end. If they want to keep that relationship going, they want to provide updates, that I really enjoy that and I encourage it. But I know that that's such an overwhelming time for them that I always let that be in their court.
Absolutely. You fit right. Like, here I am, I'm handing you this knowledge, right? And here I'm going to hand you this care package with this knowledge, do what you will with it. And I can understand that as well too. And that right in and of itself could be game changing, hopefully game changing for them.
Just that they know that the support is there should they need it. And what's nice is that so many of these patients then can help to provide that same type of support to other people that they meet that are going to be facing the same types of challenges.
Absolutely. Do you ever do oral health education with the family members?
Yes, sometimes they will be joining into the support group. Often it'll be maybe a spouse where, right now, this is what my husband's going through. And the wife might be more of the driving force to find the answers because he's just dealing with that. And she doesn't want to have him needing to go through and looking for these things. So a lot of times it is a spouse that's reaching out, or some type of a family member that wants to take some action for their loved one.
Right.
And that really is a nice way to keep that relationship going with these families. But, I do also offer educational programs for healthcare providers as well. So I also work part-time with Custom Dental Solutions, which is we service private practices with pretty much anything they need help with as far as, OSHA compliance and HIPAA compliance, their cultural or clinical trainings, things like that. And I'm able to do that from home part-time.
Nice.
And through them, I'm able to provide PACE approved continuing education for dental providers. So I can provide credits for their licensure with the training.
That's phenomenal.
Yeah, it's really nice because that way we can, and I like doing the full team training where so often I might have an office that they'll only have the doctors and the hygienists learning about these things. But I really think it's so important that everybody in the practice does, because, especially the administrative team.
I agree 100%.
Yeah, they're the ones that are going to be probably finding out first that you have a patient in the practice who's facing a diagnosis, because they're going to be answering the phone to reschedule an appointment. They're going to be answering the phone to talk about, a payment plan or something like that. And unless that administrative team member is knowledgeable about what the concerns are and is able to articulate that to the patient, you may be losing out on a golden opportunity to see that patient and provide them the help that we need in the clinical setting.
I could not agree with that more, what you just said. I think that is fantastic, because I've worked in dental offices before as well too, where administration, they pick up the phone and a patient calls and they're having X, Y, and Z issues. But if they're aware and they can have that understanding of that, they can relate to that more. And it makes the conversation a little bit more gentle and a little bit more effective, I think, when you have that knowledge.
Yes, absolutely. And I always use the example when I do my my presentations. You have Mr. Smith that calls up to say, "Hey, I have this appointment scheduled, but I need to cancel because I just found out I have cancer and I'm going to be going into surgery in a couple of weeks." That is the goal and opportunity to say, I understand. Explaining the importance, making sure they follow through with their treatment, and not just canceling. And now they're going in with possibly active decay or active infection or something that we could have addressed to avoid problems.
Right.
Now they have risks.
Right. Absolutely.
More complications because of it.
I agree with that 100%. Again, being proactive, not reactive. So guys, just a little break in the middle of the podcast. Jill and I were talking a lot about cancer therapy and what it can do to your oral health. And I did do a podcast a few months back with one of my friends, Ashley, and we had talked about why that happens. So I'm just going to fill you in a little bit more in case you didn't get a chance to listen to that podcast as to why some forms of chemo and radiation therapy can impact people's oral health. So in our body, we have a system called the chemosensory system, and that detects and transduces chemical signals to the brain. The chemosensory system involves two complexes, which are the gustatory complex and the olfactory complex. The olfactory complex controls our sense of smell. The gustatory complex controls our sense of taste, and both of these complexes are closely aligned because they share the same chemical receptors within that chemosensory system. Our chemosensory system is located in our central nervous system. So the olfactory complex is located in your temporal lobe of the brain. Your olfactory receptors are stimulated through the mucous membrane lining of the nasal cavity, and nerve fibers then relay the signals to the brain. The gustatory complex is located within a region of the cerebral cortex. There are three main cranial nerves that carry taste stimulation from the tongue to the brain. So this complex is particularly interesting for the purposes of this podcast because the neurological pathway of this complex travels to the central nervous system from the oral cavity. So when somebody is undergoing chemotherapy treatment, chemotherapy is the treatment of disease by the use of chemical substances, especially the treatment of cancer by cytotoxic drugs. Cytotoxic chemotherapy drugs permeate and attack the cancerous cell wall and kill them, which will prevent further metastasizing of the cancerous cells. However, cytotoxic therapy also may destroy normal, fast metastasizing cells as well, and this includes hair, skin, nails, the oral mucosa tissue, as well as weaken the enamel remineralization process and may generate sensitivity. So, leading into that, so when someone is undergoing chemo and radiation, Some of these chemotherapy drugs can weaken the blood-brain barrier, causing it to increase in permeability so that the drug components are able to effectively cross it. Now, sometimes this is done intentionally when treating brain tumors and brain cancer because they are protected within that barrier, and that's really the only way to get to them. Other times, there may be unintentional crossing of the drugs. Now, once the drugs have successfully crossed this barrier, they now have access to cells within the central nervous system where they may then have toxic effects on any existing cancerous cells, but also on healthy cells that are present. And this can impact the sense of taste and smell because the chemosensory system is located within the central nervous system, as I had mentioned. So, damage to the cells of the chemosensory system will then lead to dysfunction of the olfactory and gustatory complexes, resulting in altered smell and altered taste, also clinically known as dysgeusia. So, here are some side effects from gustatory malfunction or dysfunction in the oral cavity, especially from chemotherapy and radiation. So you can acquire oral mucositis is when your mouth is sore and inflamed. It's a common side effect of chemotherapy and radiation. Although mucositis is usually painful, it can be treated. It should get better within a few weeks of finishing cancer treatment. You can get mouth burns from hot foods and beverages. This burns the papilla located on the tongue that contain taste receptor cells, which can alter temporary loss of taste until the papilla regenerates. So highly acidic foods and beverages can be really irritating to the oral cavity as well. You can get a strong metallic taste from restorative material used for fillings and prosthesis, partials, crowns with metal undercoats of porcelain material, local anesthesia, salivary dysfunction, periodontal disease, acute or chronic infections such as abscessed teeth and draining fistulas. I know that that's a lot of information, but I just wanted to share that with you just so you had a little bit of an overview as to how chemotherapy and radiation can alter one's taste and smell and how that can trickle down and cause oral health complications. So I hope that this podcast today is highly beneficial and that you check out my website as well as Jill's website, which is sideeffects.com, so you can learn more about specific products that can be extremely beneficial for your oral health while undergoing chemo and radiation. Best of luck. Now let's get back to the show, guys. Again, I'm going to say this, and I will repeat myself probably 6 more times. Jill, you're phenomenal.
Oh, thank you.
I would love to know. Let's narrow down. What can you not do?
Oh, quite a few.
She's like, oh, don't get me started. No, I'm just trying to make the conversation about it because this is a heavy topic. This is not necessarily a fun topic to talk about, but it is extremely important and imperative that we get this awareness out there.
Yes. And, thankfully, cancer treatments have improved so much within the last how many years since I started this, that we have more and more survivors that we're seeing in our practices all the time. So their problems don't necessarily end when their treatments end.
Sure.
So we need to understand that, okay, this person maybe was a childhood cancer survivor. They still, as an adult, could be dealing with some of the after effects. So it's important for us as dental providers to understand what those long-term effects may be.
Absolutely.
And not only knowing what we need to do in a clinical end, but providing them some grace for the problems that they may have be dealing with. Because I think one thing that always breaks my heart when I do the patient support group meetings, it is almost guaranteed that I'm going to have one of them ask, how do I find a dental office that understands my needs? How do I go in and I feel ashamed. I feel judged for the problems that I have. How do I find one that's, understands this?
Sure.
And, so that is heartbreaking to me, that anybody would have problems because of all of these medical treatments that they went through,
sure,
only to feel judged and ashamed.
Absolutely.
To go into the dentist.
Yeah. And I'm going to say this, but shame on dental practices or people within dentistry that would treat patients that way. That's extremely unethical. So I just wanted to throw that out there. I had to say that just because of that little story that you just shared.
Yeah. And it's surprising, how often I hear that.
That's sad.
And it's not always the clinical staff. Sometimes it's the person scheduling the appointment, like, oh, you got to, obviously you're not taking care of your teeth because now you got to come back for this again.
Right. Like, what are you drinking? What are you eating?
Yes.
What are you doing wrong? Well, nothing. This has to do with my systemic health. This is something that I'm dealing with. And that's just it. You have to look at each individual person as their own unique case. You have to, because you have to look at their medical, their medications, their oral health. You have to look at that as a whole and say, okay, let's figure out what's going on here so that we can help correct this, or we can help bring you back to optimal health in every area of your life. So, and it seems like you focus on that as well too. I know you're not just focused on oral health. I mean, you just seem like you have this amazing, compassionate heart as well. You feel their pain. Yeah.
Definitely. I definitely do. And I think of a few patients that come off the top of my head right away that it's just, I would go home at night. I would just research, just trying to find anything I could do to find some answers for them. Absolutely. And just really, if I could just help them a little bit, it was so rewarding.
Absolutely. And even when someone is done with their chemotherapy or radiation therapy, a lot of times they are on long-term medications. And you and I know also that a major side effect of dry mouth is medications. Yes. So we have to also, as dental professionals, when you're looking at a patient clinically, especially post, cancer therapy, okay, so what medications are you on? Okay, well, you still have, dry mouth or altered taste and things like that. So we are going to continue, certain forms of therapeutic agents with you and for you until that subsides.
Yes, absolutely. And sometimes there's different medications that are used in conjunction with treatments.
Yes.
As far as many times they will receive like a steroid, like a dexamethasone, that to help keep their appetite up or to reduce nausea. They might be on anti-anxiety or antidepressant medications because of the whole experience. And some certain types of cancers may have hormone therapies that can affect bone mineral density.
Sure.
So there's all these little nuances that can really be so different from one person to the next, depending on the type of cancer and the type of treatments that they receive.
Absolutely. So do you feel that there are certain types of cancer have more detrimental effects on a patient's oral health?
Definitely the oral cancers, just because of the treatment being so localized in those areas, they probably are the most susceptible just to the severity of the long-term results. But I would also say people who have gone through bone marrow transplants and deal with a condition called graft versus host disease, where the donated cells can actually attack their body, and the mouth can be a real significant area affected by that. And there's no cure for that either. So people who battle severe cases of graft versus host disease, it can be really have a big challenge with their oral health, and even sometimes with children, especially at certain ages, if they're going through their treatments. I believe it's before the age of 5, they could have misshapen teeth, they could have missing teeth, they could have a lot of growth and development issues because of the way the treatments affect that process.
Yeah, absolutely it can. And it can, like you said, and it can impact their adult dentition, and they can have issues into adulthood with that.
Yes. Yes. And some things just aren't necessarily solvable, but they are things that we can hopefully help to keep under control for them.
Sure. If you had access to every oncology center within the country here, what would you want to, for one, say to oncologists in regards to oral health, but what kind of treatment plan would you propose to them for their oral health?
I think, again, it would be going back to taking that patient's medical history, dental history, collaborating with a dentist. To me, that is so vital, that if we can have, a certain dental practice or people that do also take this interest, that can work well with the oncology center, that can be a resource for them.
Sure.
Working with them to anticipate what the issues might be, being proactive, but then making it easy for that patient to digest the information. And that, I kind of go back to that initial volunteer program that I had. So right now on my website, I've got some kits that are just these little pre-made kits that have really easy to understand information, and then some sampling of things that they can just go and start using right away. Because I think it's unrealistic with the amount of information that patients get as they're entering into this.
Sure.
I think of my dad when he went through his first chemo. And of course, we get like a 3-ring binder that's 3 inches thick. And I started paging through it because I'm thinking, okay, I want to see what they offer for information on this. And there was one little paragraph about oral health or oral complications. And even though I was looking for it, I thought, that is just, there's no way that somebody's going to find this, number one, take the time to read through all of this information, be able to digest it, and then from there, take action on it. So if they have something they can start using right away that lays it out very simply, you've just given them a leg up on actually doing something about it, because it's so unrealistic that we sometimes give this patients all this information and then we send them out to go to the big box store or the pharmacy and say, okay, now find all this stuff.
And you want to make sure that they're getting the right one that suits them and their needs.
Yes.
Right.
Yes. And everybody's a little different with that. And I usually tell people there's no magic bullet. What works well for you right now may not work as well as you go through farther into the treatment process, as your medications change, as your body chemistry changes. So be open to experimenting a little. And I think that is one of, as I go back to the financial thing, I put a little shop on my site. It allows me to do some of the vetting of the products.
Sure.
But it also are things that I really try to find things that were affordable.
Absolutely.
And that way they have more ability to try things out.
You make it so easy, which is great. You know what would be lovely that you could do, possibly being like a dental and oral health coach in conjunction with that, which would be fantastic. Like, I'm here to, I'm here to counsel you on your oral health, because, by the way, this can significantly impact your oral health, and here's how, and here's why.
I always want to be available for people when they have questions. But I actually had partnered for people that don't have a dental office or a dentist that they typically see, or maybe they are too medically fragile to actually go into the dentist. I was fortunate enough, I partnered with the teledentist. So anybody can go on my site and actually access a virtual dental visit within 10 minutes or less.
Wow, that's phenomenal. You're reaching so many different people. I mean, think about the impact and the lives that you're changing.
Yes.
She's like, Sarah, stop. She's like, stop.
I really, that's what drives me every day. The thought that, somebody is going through a hard time, and if I could make that a little easier for them, it means everything.
I love that you live to serve others. I just read a quote. It was a book that I was reading, and this man who's out in the world making significant changes in developing countries, he said his mother always told him, if a life is not lived in service in helping others, then a life is not worth living. I was wow, that was very profound for anybody. No wonder why this man went out and did that, especially if that was something that was instilled in him. But Jill, that's exactly what you're doing. And no wonder why you have such a great passion, because you're getting such positive feedback from people, and you know that you're significantly changing people's lives.
I come from a family that's just what you do. I come from a long line of people that were made up of the volunteer fire department. Mm-hmm. They all volunteered to be EMTs on the ambulance. Mm-hmm. That was just, it was so normal for me that at Christmas time, the scanner would go off and half of our family would be gone because there was a barn fire or an accident somewhere. Right. And that was just what you do, is you help people that need it.
I think it's phenomenal. So I did go onto your website, sideeffects.com, and saw that you have several products with a low neutral pH for patient healing and dry mouth. So what would you recommend for a metallic taste, as this is a growing concern in chemotherapy and radiation treatment as well?
So I looked around for different products that might help people with that. And I know sometimes treating the dry mouth can help with taste issues because there's certain taste buds in our tongue that are dependent on saliva to function properly. But I came across a really interesting product called Medikill. Oh. And so that is something that offers help to people with taste changes. And it's been a great thing to offer during the COVID problem as well, because so many people will mention, that is something they really struggle with after recovery.
Absolutely. Yeah. I did a podcast on COVID-19 and the fact that so many people, even like 6-8 months later, were still having that kind of loss of taste, loss of smell, dry mouth symptoms. And I was like, oh, I want to learn why. So I kind of delved into the research and I did a podcast on it. And yeah, there was a lot of people that got some listens. So just everybody wants to know why.
Yeah. And in fact, I have a few family members that lost their smell with COVID, and they have found great results with, I have clear nasal spray on my site. And they said once they use that, it really helped for them to get their smell back.
That's phenomenal. That's good to know. So you do like that. Have patients been on your site, getting that Medikill product?
Yes, it's fairly new to my site.
Okay.
So I haven't had it on a long time. So I'm trying to build the awareness that it's available.
Sure.
And get the feedback that goes along with it.
Right.
But it's a great tasting rinse. And I'm just glad that we have additional things that people can try.
Yeah, something for both. Because again, like you were saying, obviously with chemo and radiation, we know that it, can impact things greatly, especially in the oral health, not only dry mouth, but as well altered taste.
Yes.
Yeah. So that's great. So a couple more questions.
Okay.
What advice would you give to family members of a loved one who is undergoing chemo and or radiation therapy? So what advice, if you were not able to speak directly to the patient, what advice would you give to family members?
If it's possible, there's an ideal window where seeking dental advice is ideal before treatments begin.
Right.
So if you have somebody, and usually it's not for every case, but many times cancer, I always call it like the hurry up and wait issue where, by the time they go from diagnosis to actually starting treatments, there might actually be, several weeks in that time span because they go from one doctor to the next with tests, surgeries, they have healing time, and then they'll maybe starting chemo a couple of weeks after that. So if somebody is going to be entering into treatments, if they can make sure they call their dental office, make sure they're up to date on their x-rays, make sure they don't have any outstanding treatment that needs to be done, and then start getting that information and making the changes before they even have a chance to start the treatments.
Right.
And that can really just provide them the best chance for positive outcomes. But yeah, I think the biggest thing is really letting them know that they're not alone, that this is more of a common problem than probably what they ever realized or probably never thought about before, but just empowering themselves to have everything they need to make the best choices for their own health.
And I think it's great too, because it's people like you who are willing to sit and listen to them when maybe, other doctors and other professions right now just say, oh, well, I'm sorry, there's nothing I can do to help you. Oh, it's just a side effect. Or it's just a symptom, but it will pass. don't worry about it. We need to focus more on, your healing and everything else, where you're sitting there going, no, I hear you. I see you. I understand you. Let me help you.
Yes. And I have the benefit where so many times different providers, and we know this in the dental practice, you've got a schedule, and you've got another person waiting, and you've got to get the room cleaned up, and you've got all these things that you need to fit in this little time span. So when I'm not in a clinical setting like that, there's more flexibility and more ways that I can provide that emotional support, I think, than what other people can sometimes.
Absolutely. This is your calling.
It is.
You know this. Okay. I am going to close this podcast with one more question. Okay. What does it mean to you personally, to support these patients?
So much. It's hard to even describe, because, I think being on the other end of things, when you have a family member that is faced with this diagnosis, and I understand the fear, I understand the helplessness, and I think for me is I hated that feeling. I don't like feeling helpless in any way, and if I can help other people to not have to feel that, and to be empowered to take control over the situation more, that means the world.
Absolutely. Jill, we need more hygienists like you out there.
Thank you.
I would absolutely love for us to do this again. I would love to absolutely talk a little bit more with you in regards to, some products or certain ingredients and certain products that you feel are extremely beneficial as well to patients who do have chemo and radiation therapy, as well as, dry mouth, metallic face, things like that. So I want to do this again with you. You are a phenomenal guest. You are amazing.
You.
And I just make people laugh. You guys do all the hard work. I just try and make everybody laugh. No, but this was extremely informative, and I am going to encourage so many people to really listen to this podcast and hopefully gain awareness more and more, just how important it is to know that there's help out there for people who are undergoing chemo and radiation.
I appreciate you helping me, or giving me the opportunity to spread the word.
Yeah, absolutely. So we will be in touch. Absolutely. We will do this again. Any closing thoughts that maybe you have, or anything that you'd like to say?
I think there's a lot of ways that dental professionals can take action to help make a difference for people that are facing a cancer diagnosis. And I hope that, they take the time to stop by and check out the website and look through the lots of free information that's on the site, and let me know if there's ways that I can help to support them in their practice as well.
And I also think that this is something that I wish someone would have told me when I graduated dental hygiene school, is you take that knowledge with you that you learned. You bring it into your dental environment, but I don't think you realize the position that you hold when you are working with a patient individually, and how much impact you possibly can have on them.
Absolutely.
And the more knowledge that we have as dental professionals, especially dental hygienists, because we do spend the most time with the patients, we can do so much education and change things. We can change the dynamic, I feel, of dentistry through our education and through our voice.
Absolutely. We have a big shoes to fill.
Yes, we do.
Absolutely.
But we can fill them.
Challenge accepted.
Jill, I know, right? She's like, put that on my whiteboard. Me too. This was lovely. I value you. I think you are amazing. I commend you in your services and what you're doing. And you are inspiring me even more and more to want to keep this podcast going. And like I said, get louder and louder and louder, and we can really change things. So thank you so much for taking the time, and all the little glitches that we went through to get this podcast up and going today, sweetie. You rock.